where caregiver they get into relationships, and or their partners do not believe, they don't believe in like contraceptives, do not believe in something like the use of condoms and stuff during intimate moments. So how do you start, like, how do you create that boundary, like, how do you emphasize that?
Is to, again, asking what are your values? What's your value system? Because if you are entering into a relationship and there's this individual who says they are not going to use condoms, where does that leave you? Consent can be withdrawn at any point. So that is even right when you are having just before sex, if the individual doesn't want sex no more, at that point, it shouldn't. Again, just desensitizing on the stigma. You don't have a problem. You're just living with HIV. You don't have a problem. You've just experienced abuse. You don't have a problem. You've just a bit low. You're depressed. And it's a situation.
Hello and welcome to Resilient Voices, the podcast where we amplify the stories and journeys of caregivers navigating life after care. I'm your host, Charlene Ochieng, and this is a conversations where we're going to be speaking about the healing journey. And today's episode, actually, we're gonna be speaking about sexual and reproductive health, and the well-being of caregivers. And with me here, I'm actually joined by Japhet. Right? So Japhet, tell us about what you do.
Thank you very much for having me. As she has said, my name is Japhet Miano. I'm a counseling psychologist who works in LVCT, actually within the digital one-to-one digital health department, where in particular we have a call center, and so I work there as a counseling psychologist.
Yeah. Wow. Okay. So, as we continue on, what I would say is that depending on the environment where caregivers actually have grown up, so many find it challenging to assess information, or have no agency or the guidance or matter regarding their sexual and reproductive health. Okay. So this lack of awareness and access puts many at risk of preventable illness or poor nutrition, hygiene and challenges, and even reproductive health complications. So what I really wanted to start is I want to start with, how do we encourage open conversations without fear regarding your sexuality, reproductive health within the peer, profession, and other important people in their life? Like, how do you start these conversations?
As you said, it actually starts with information. Being informed that these are conversations that indeed we need to have. Being informed of the different myths and misconceptions and the realities of especially sexual reproductive health. And it's from that information that we get to remove the biases that would may be there, and be able to have an open and genuine conversation first with ourselves, and then with the people in our communities, including those we care about. Yeah.
Okay. So you mean like we have to have the support, the people around us who we can start like those conversations, I guess?
Yes. A big factor within sexual reproductive health is that community. Do I have people who I can reach out to? Do I have people who we can talk? Do I have people who, if I'm seeing some things and I don't really quite understand, do I have people I could be vulnerable to and be able to precisely have that conversation? Yeah.
Okay. So to the next one, I want us to ask, what are your views on measures one should take when someone disrespects your boundary? Like what are some of the measures we should take caregivers should actually take?
First of all, it's understanding your boundaries. Again, knowledge.
But what are those boundaries? Like what is a boundary? Like you don't know. At what point do you say this is now the boundary has been crossed? And na utajuaje like hii boundary imecrossiwa when it comes to your sexual and your reproductive health and stuff. Yeah.
Again, circling back to what I've stated again, it begins with the self. So the individual, either male or female, needs to first understand, who am I as a person? What are my limits? By my limits are, am I ready for sex based on the age that I am in? With this partner, with this person that I've met, am I comfortable enough to have sex with them? And that's precisely now where you draw your boundaries. What level of engagement relations would I have with said person? From that now, you now put the different laws. For example, if you are sexually active, there is someone who's not sexually active. So if you are sexually active, are you using a condom? For this other individual who may not be sexually active, do they understand that actually you can't say no? And you can't say no, and it at whatever point it is that you said no, that should be followed. So it's really understanding yourself. What are your rules? What are the levels you as an individual won't want to pass?
Yeah.
And then from that, implementing it with the people who are relating with you.
Okay. Okay. Wow. Okay. That's quite quite interesting. And so so basically you're trying to say is that it's about knowing your boundary as a person and knowing what and emphasizing the use. For me, it's like understanding the when it say no, it's a no.
Yes.
When it comes to your sexual boundaries, and having the awareness of this is what is respectful and okay for you as a person. So that is what is needed to be able to be to create that boundary for yourself, right?
Yes.
So what I want to know is what does so I think we have actually answered this. And what can you talk about the aspect of contraception? Like how do you even start those conversations? For caregivers, women or caregivers, or even just generally, like how do you even start that? Because also that could be a boundary, right? There are cases where caregiver they get into relationships and or their partners do not believe they don't believe in like contraceptives, do not believe in something like the use of condoms and stuff during intimate moments. So how do you start, like how do you create that boundary, like how do you emphasize that?
So to begin with, allow me to address just something that you mentioned.
Right.
There's the misconception that sexual reproductive health is a women's thing. It's not about women.
It's not, right.
It's about both of us. It takes two to tango, yeah? Right. So when it comes to sexual reproductive health, it requires both individuals to be in the space where they can have that conversation. One. Two is to, again, asking what are your values? What's your value system? Because if you are entering into a relationship and there's this individual who says they are not going to use condoms, where does that leave you? How do you feel about that? What are the risks to that? Do you understand the risks? And it's being able to have that conversation. By the time you're saying, yes, we're in a relationship, at the point at which we're engaging in sexual activities, there is a risk. There's a risk of pregnancy. there's a risk of STIs and STDs. And it's really important to understand those risks. Then understanding the different mitigating factors, for example, using a condom. There's the assumption, especially in these streets, in this day and age, that there is a lot of emphasis on preventing, on family planning, but very little emphasis on using a condom. So you find an individual has different family planning methods. Probably they're on the pill, they're on the daily pills, and that prevents the pregnancy, but not the STIs and the HIVs, and so it's really understanding yourself. You've also asked about what kind of contraceptions are there. There are multiple. There are multiple with different effects. There are hormonal methods which really alter the hormones of the lady. And most of these, contraceptions, it's really important to be able to have that conversation with two individuals. One, your partner, two, the doctor.
Okay. So what would you say about people who are very forceful? Like, and we know, like right now, even in our country, we have a lot of cases of GBV where people are being forced or violent, women and men, I think, I believe, who are very violent when it comes to matters sexual. So what can you say about that, and what can we do to what can caregivers actually do to mitigate that?
That's a very
or even where should we go?
that's a very complex situation, because we're looking at these caregivers. GBV, that's gender-based violence, right, is not an issue that is sporadic. It actually is a real issue in this society. But there are different factors to understand. Again, understanding self. Am I vulnerable? What makes me vulnerable? Okay. For example, a caregiver who's seen abuse, who during the time of their development stages, they've been able to see abuse. That in turn affects them as they are adults. Also looking into their understanding of different things, like the boundaries. What boundaries do you have? What's your understanding of love? Because if you see love as violence, it's very difficult to turn that. The conversation of, but he loves me, it's like, no, it's a cycle of abuse. And ultimately, consent can be withdrawn at any point. So that is even right while you are having just before sex, if the individual doesn't want sex no more, at that point it should end.
Yeah.
So it can be withdrawn even mid-sex. It can be withdrawn, and that's something that needs to really be understood. That and this goes for both men and women. At any point, it can be withdrawn, and it is okay. And it should be respected, because ultimately it's a choice. Yeah.
Wow. So when it comes to access to information, there's a lot of discrimination that caregivers actually go through, especially for persons who have HIV. There are also factors such as the age, the culture, your disabilities. These are some of the issues that that persons or caregivers actually go through when it comes to assessing. So what advice would you give caregivers who may experience this type of challenges when it comes to assessing the information or even going to the facilities or of help? How can you give advice on that?
To the healthcare leavers, rather to the care leavers, I'd say this. There's a lot of misinformation out there. Let not that misinformation prevent you from accessing the services that you need. Because ultimately, especially for individuals who are probably living with HIV, you understand the differences. You understand that we can eat together and HIV cannot be transmitted. But there is someone who's conditioned differently. So it's understanding that you can get that information and inform yourself, but ultimately the conversations, changing that narrative begins with you. Changing that narrative begins with understanding who you are, being informed of how can you keep yourself safe. More to that, how do you keep your partner safe? You're a person living with HIV. At what point do you communicate? Do you communicate? And it's also understanding that the current society has a perspective regarding HIV that might not be true. And of now, there are new developments. For example, with the coming of PrEP and PrEP. So HIV now is slightly different, or a lot different than 20 years ago, for example. Recently, there's a new drug that has come up for PrEP that is injectable. So it's understanding that there are developments, and the world slowly is coming to a better space. But again, let not the conversation prevent you from accessing service.
Okay. So that includes even persons with disability, with your age, with your culture, all that.
Yeah. Yes. Unfortunately, it's also understanding the space in which we exist in which we live in. Unfortunately, the country that we live in, the society that we live in, there's a lot of stigma around HIV. So circling back to actually something you shared about having communities, it's very important. Being able to have the individuals that you can reach out to speak to. Having that community helps in coping. Yeah. For example, if you are a person living with a disability, subsequently also HIV positive, and you need someone to talk to, and being able to be vulnerable with not just an individual, and it cuts across men and women, being able to even seek therapy, being able to say, I'm not okay, this is what's going on, and I just need support.
Okay, so what about when it comes to what needs to happen to the caregivers, to caregivers to have the autonomy over their body? Like what needs to happen now that we have said we there's that understanding of self, but also now what has to happen now, like yeah.
Okay. When it comes to now autonomy of self, it starts again, as you've shared, from understanding yourself. Understanding the kind of situation you're in. Understanding your worldview in terms of your experience. By that, what I mean is, what's your life story as a caregiver? what are you vulnerable? Through your life story, what does it make you vulnerable towards? For example, or susceptible towards? For example, violence. For example, HIV. For example, mental health concerns. What keeps you? What makes you vulnerable to some of these things more than others? A person who's living with HIV has a lot to think about. You know, there are a lot of concerns, especially now as they are approaching the point of relationship. Some of those concerns could be addressed in therapy. But you see, the individual needs to first know that this is the space I'm in. This is my history. This is my background. And their background does not determine your future. So it's being able to first figure that out. And then from there, it's being able to work on those boundaries.
But now, how would you put it now within the community, within like outside? Now, let's say as an individual, as a caregiver, you have understood who you are, you know, like what your boundaries are. But now at the on the outlook, you know, on the outside part, like the community and society, what is the expectation? What should happen, or you know, yeah.
Okay. In this society, it's it's very complicated in that the world, in my experience, is very unforgiving. You know yourself, yes, but it's also understanding that there's another person you're relating to, and this person has their own history. So it's keeping yourself in spaces that are safe spaces. Limiting, not necessarily limiting, but being able to continuously engage with individuals who can meet you where you can, recognizing the space where is a bit toxic, recognizing a space where it's taking from you more than contributing to your life, so that you can extract yourself from that space. Is also being aware of the different points that you can get support. Is understanding that you can actually get support, where to get support, and how to get support, what's to expect. For example, a person who has survived gender-based violence, what happens?
Where do they go?
So it's knowing that to begin with, especially the sexual and physical violence, it's first to go to the hospital, be able to first ensure that you see you're able to get checked medically, first for your safety and also for the preservation of evidence. Then from there, the doctors give you a form you fill, and that is now taken to the police station, which is where you can report. There are different organizations and groups that support. For example, one very notable one is Usikimye, that are able to continue the follow-ups. So it's being able to understand those different avenues. Also being able to understand, like now for us, one-to-one, being able to know of the different hotlines, the child helpline, the call center, one-to-one.
Yeah. So, I mean, you have said Usikimye, one-to-one. What about places where people can, caregivers actually can get all this information, as you said, one-to-one, Usikimye, and any other more you can add platforms that, caregivers can get more information or even help when it comes to, where do we get by the way, where do we get contraceptives?
So, for example, now with us, one-to-one, when you call 1190, you speak to a counselor like me. And from there, we're able to refer you, for example, if you are looking for medical support, like those contraceptives, majority of the contraceptives you could find in a hospital and or chemist. But there's other different things there are other different things that you might need or might want that would now require, if you now call 1190, be able to be supported. For example, we refer clients who need legal support, who need medical support. So by calling us, you'll be able to be directed, be supported to access the service that you are looking for. Also through the websites, the information is a lot, but also trusted websites.
Which websites will you recommend people to go to where they can get this like information?
There's a lot of information regarding sexual reproductive health, mental health, and GBV and HIV in the one-to-one website. In particular, there are also stories, personal stories of individuals with lived experience. Now comes back to your community. Some of these stories, being able to read that it's not just me who's going through this. It's there are other individuals, and they're being able to navigate through life. So for them is to be able to just go through the website and also get encouragement from other people's stories.
So we've spoken about like having support as a community. So the question, Nikonani, what are your views on mentorship and peer support program? Do you think they're good to help caregivers feel more confident in navigating issues regarding sexual and reproductive health? Like, do you think they're important? And how do you even start having Tanzaji as a caregiver to create this? How would you recommend, like what would you recommend the best ways, or even how do you start these support groups into your, and even what are even support groups?
They're different. There are different communities, support groups that are out there. There are, for example, one common one is Alcoholics Anonymous. These are now for individuals who would like support in their recovery journey from addiction. Other than that, there's also the HIV support groups, the person living with disability support groups, and all these different support groups. The key point of them is what's the goal? What's the purpose? And do you share that? What's your purpose? What's your goal? And who do you share this goal and purpose with? Okay. So, for example, I am a person who's struggling with my mental health, and I come and speak to you. You're also struggling with your mental health. So we have a shared purpose, a shared goal that we would like to be there for each other because we probably are navigating suicidal ideation. From that, then we get other individuals who are supportive, who are going in the same direction, who would be there to check in on us. So for this support group are individuals who can hold us accountable, individuals who we feel safe with, people who we can be vulnerable to. Coming to having mentors, they are very important because ideally this mentor is an individual who's older than you are, who's experienced life a bit more than you have. For the caregivers, is asking who would best understand you. Is it me who hasn't gone through the process, or is it an individual who's been in the same journey as you have been? So again, unity in terms of mind and purpose. So it's finding a person who is able to call you out. You say, yes, you have gone through this journey of health, but you can't keep on playing risky games. Yeah, it's a person who would sit you down and say, yes, you didn't have that opportunity to figure out how to navigate the world living with HIV, given that you are born with it. But there's a certain way that you could live your life as an adult. Probably you've experienced violence, and you've survived violence rather. So it's a person who could be able to talk to you and remind you of your vulnerabilities. A person who could be very honest with you. A person who could tell you, call you out on your red flags, and call this individual out, your potential partner, on their red flags that you are not seeing probably. So mentors are very important because they are able to see things that probably we can't see. And how do you get a mentor? Again, purpose and goal. So I could have the same purpose as you, but I don't have the same purpose as Alice, for example. So as a mentee, who would be able to support me in my journey?
So basically is, maybe I might be reiterating, but is finding the problem that you have, and finding the support group that you actually need, and the help that understanding the problem that you have, and then finding the support group that might actually help you navigate through that.
I agree. Actually, that's it. With just one caveat. I personally tend to look at them as not as problems per se, but life journeys. A situation that this is a situation in your life journey. It's not a problem. Again, just desensitizing on the stigma. You don't have a problem. You're just living with HIV. You don't have a problem. You've just experienced abuse. You don't have a problem. You've just a bit low. You're depressed. And it's a situation.
It's a situation at the moment.
Yes.
So I would also want to add, even for KESCA, which is the Kenya Society of Care Leavers, is also like a very great networking platform for care leavers. So this one is also like a sort of like a support group, because we know each other, and we understand each other in a way. So I believe this is a one support or a network that care leavers, if you're out there, you can reach out to KESCA, and there are different. There's also even a WhatsApp group, I believe, that gathers all the care leavers together, and you get more information on that on the description below, actually. Thank you so much. This was a very insightful podcast. Unless nimeacha kitu. Unless it's something uko zile hatujaongelea, but so anything you want us parting short,
I'd speak to, again, the care leavers, and this goes to both men and women. There are 4 issues, or rather, there are 4 themes that affect an individual's life, and that is the mental health, the sexual reproductive health, HIV, and gender-based violence. All these 4 themes, in one way or another, we interact with them in our lives. And that is unavoidable, as it's a consequence of life. However, there is support. An individual can get support. And this is not limited to women. As you stated, there's the misconception that, for example, therapy is for those who are weak. Actually, it takes a lot of courage to say that I'm not okay mentally, I'm not okay emotionally. More so as a man, being able to say, right now, I probably don't have the finances I require, the finances I need to survive. I probably have seen trauma with all the things that are happening in the country right now. You've seen trauma in terms of primary trauma, where probably you're in the protest, or secondary trauma, you're just watching all that's going on in the social media. So it's looking at how does all these things that we are navigating, all these different challenges now, precisely, that we are navigating through, how do we speak about them? How do we cope with them? It's being able to say, I am not okay, and putting the active measures. For example, saying, I can't now be on social media. Let me take a break. Let me take care of myself. Is being able to ask yourself, what other coping mechanisms do I have? Can I breathing exercises? Being able to take care of your diet, being able to look into exercise, being able to look into different activities that you can engage with, and looking for different distressors that are good coping mechanisms. And then from there is asking, okay, I have done all this. I've tried all this. What else can I do? If I'm still in this space, what else can I do? It's being able to have the courage now to seek counseling support, being able to call or text 1190 and say, yeah, I would just like to talk to someone. And this is not just for ladies.
And is 1190 actually free of charge?
Yes. 1190, calling and texting 1190 is indeed free of charge. And again, you speak to an individual who is there about your age, who's also a young adult, who's also in that space. And especially for, now coming back to your question, for men is to recognize that this conversation involves us too. The conversation on HIV involves men. The conversation on sexual reproductive health and rights involves men, especially the rights, the journey through the journey through looking for love. The sexual intimacy, it's not an individual thing. It's a combination of two individuals. So both individuals need to play part in the different decision making. So contraception is not about, again, like I said, it's not about women. It's about both partners. Gender-based violence, it's not about women. And it's not about saying, yes, men also get abused. But it's figuring out, where are you? Could I be a perpetrator? What things could I stop myself? What things should I just not do? Could I have conversations in spaces like communities you're speaking about? What are my friends as men? What are my friends speaking about? How do they value women? When we are talking about women, what comes to their mind? It's being able to really interrogate that, because from your community is now where you get to the information. You get the information on how to deal and/or react to other individuals. So if you are in a toxic environment as men, are you able to call them out? When it comes to being physically violent or emotionally violent or violent of whichever nature, are you able to say, yeah, that's not something that you should do? And being able to categorically say that, especially to your friends. Yeah. And also just being informed that on these issues matters: mental health, gender-based violence, sexual reproductive health and rights, and HIV. So parting shot in truth would be your journey before does not determine the journey of life that awaits you. That you can take control of the narrative, of your narrative of life. You can take control of where your life goes. And that begins by being informed and moves on to actually taking actionable steps. That is seeking support. That is being supportive to other people. That is figuring out where you are at and being able to take care of yourself. Changing that narrative requires a lot of work, but it is you working on yourself. So ultimately, that's the best kind of work you should do. You could do. And finally, there are support. The support you can get. There are people who are there to support you, help you. Being able to be vulnerable is a good thing. Being able to say, I am not okay. Being able to even call 1190, text 1190. Getting that information, getting that support is critical in changing your life story. Yeah.
Thank you. Wow. And as caregivers, I hope you know and you get to know that understanding your health in terms of your sexual and reproductive health is very important. And as Japhet has told us, is that you have to understand first. You have to understand yourself first and be able to understand what your boundaries are, and then be able to get informed with the information that you might need. And also, I really, really want to say seek support, because there's support actually out there, and one-to-one, and Keska also is here to support you. Thank you. Thanks for watching. Thanks for watching. This was Resilient Voices. Don't forget to follow us, by the way, and subscribe to this channel, and also give a like, and also you can give us the comments below. What have you been doing to seek support yourself, so that we can keep this conversation going. Thank you.